Hey ladies, this episode is especially for you, the person who is doing everything right, but is still hitting all the issues that come with transition into perimenopause and menopause. You're starting to gain weight, perhaps more in the middle section. You feel like maybe you're going crazy. You're not sleeping well anymore. You're irritated at little things. And you've got maybe some other changes happening in your body that you just really don't understand. My name is Dr. Annie Armstrong. I'm a certified sports chiropractor, and I'm really excited to have Dr. Marcy Nelson here with me today. She's a family medicine physician and a certified menopause expert. I will let her introduce herself.
Hi, I'm Marcy Nelson. I'm a family medicine doctor. I've been practicing for about 23 years in the Seattle area. Did prenatal obstetrics, full family medicine, and I've followed my patients through many changes in their lives over the last number of years and really enjoyed that aspect. Over the last few years, it's become really apparent that there is a huge gap in the ability to find care for those of us going through the transition of perimenopause, menopause. And unfortunately, a lot of physicians, whether it be family medicine or obstetricians, gynecologists, we're not really trained in a lot of details of menopause care. And so these days, we're starting to realize that there's a gap in care, there's an opportunity for improvement, and women are starting to ask a lot more questions and talk about menopause. And so that prompted me to go back and get some additional training and become a certified menopause practitioner through the Menopause Society of North America. And so I've transitioned my practice into really focusing on women in midlife and women's health, and that's what brings us here together today.
Yeah, it's such a huge topic, and really, I'm embarrassed to admit that during my transition, I really didn't know what was happening either. And I'm in medicine. I'm working with women every day who are struggling. I'm struggling, and I'm like, what is happening?
Yeah,
my
you're not
palms
alone.
are itchy. My skin's dry.
Mm-hmm.
I'm not sleeping. All these things are happening to
Brain
my body.
fog.
Right. And I'm like, I don't know what's happening anymore. So I'm so excited to have you here with all your huge depth of knowledge. And I thought it'd be really let's start with the basics.
Yeah.
Like, what is menopause? What is perimenopause? What is happening to our bodies hormonally?
Yeah. So menopause is actually defined as not having a menstrual period for 12 months. Beyond 12 months, you're postmenopausal. But perimenopause can last anywhere from like a few years up to 10, 11 years. And perimenopause can start as early as our mid to late 30s. And it is a transition. And it's a time when our body is transitioning from estrogen and progesterone cycling in the regular menstrual cycle to a drop in the estrogen. And when estrogen drops in our body, whether it's fluctuating in perimenopause or drops and stays low in postmenopause, that changes our body in many ways and creates a lot of changes in how we feel, where we gain weight, our bone strength, our muscle strength, and many, many other facets of our life.
Yeah, and so clinically, I'm a chiropractor, and I train women. I not just women and men, but predominantly women, I will say. Mm-hmm. And I think some of the changes that I wasn't aware was actually perhaps a perimenopause event and change for them. Now that I know these things, I feel so much more empowered to be able to help them. But I mean, some of the weird things that happen, I think we should just touch on because it may resonate with someone, right? For me, it wasn't so much the midline weight gain, which is what a lot of women say. They're like, I don't know what's happening. Yeah. I'm eating the same. I'm working out the same. Nothing has changed. And I put on 10 pounds and it's right around my middle. Like, what the heck is going on?
Yeah,
right?
I hear that all the time in my practice.
All the time, right? And really, it's like this, like, I'm going crazy. Mm-hmm. And then there's the whole mental aspect. Like, I mean, women are like, we're literally are hormonally imbalanced. Like, it's like your worst... your worst day over and over and over again, right?
Yeah.
But for me, what I saw the most in practice was just this strange joint pain. I mean, women were hurting everywhere. And I'm like, why? And they're all of a sudden, their knee hurts, their ankle hurts, their shoulder hurts. They're getting a frozen shoulder. Mm-hmm. They're getting itchy. They're getting dry skin. They're getting tinnitus, like ringing in the ears, vertigo.
Yep.
And I'm like, what is going on? What is going on? And so I think today we wanted to sort of narrow down a little bit and talk about kind of the big one that really probably hurts us the most is the weight gain piece, right? Which women struggle with so much, and they aren't winning the battle. And there's a reason why.
Yeah.
So enlighten us as to what's going on.
Well, as estrogen levels drop in our body, it changes our metabolism, and it is part of the process of transitioning towards menopause. The perimenopause time is really difficult because of the fluctuations. So your body is accustomed to a certain level of hormone at a certain time of the month, and when that is all fouled up, it can be very disruptive. So we definitely see that fat from the external body, from our skin and from around our tissues, sort of seems to migrate into our tummy section. And it has to do with metabolism, and it has to do with cortisol. And so just understanding that that is part of the menopause transition is really important for and empowering for women, because they think, well, what am I doing wrong? Like, what I'm doing all the right things. Everybody's told me that I should eat this way and exercise this way. And yet they are either maintaining or they are gaining weight.
Yeah. And
so that's really tough.
Also, the insulin resistance piece,
yes,
is a really
part of the metabolism issue.
Right. It's a really big piece. And we're losing, I mean, I don't remember the exact percentage of muscle we start losing automatically when we cross over the age of 40.
Yeah.
It's like something like 20% a year.
Well, testosterone levels start dropping at 35.
Wow, yeah. And so we're
and
losing
so
muscle mass.
Testosterone drives muscle mass, is one of the many things that drives muscle mass. And then as estrogen levels drop, that also exacerbates the muscle loss. And then, there's a lot of issues with sleep. For a lot of women, they're either having hot flashes at night that wake them up, or they're just having insomnia. Despite not having hot flashes, we still have sleep disruption. That creates a lot of chronic sleep deprivation, which then, of course, feeds into mood dysregulation, anxiety, depression, etc. And that makes it hard for you to stay motivated to go out and exercise. And it is hard to stay motivated to eat right. And, there's a lot of misinformation out there about how to eat and how to exercise. And I think that there's a lot of myths that need to be dispelled for perimenopause and menopausal women.
Yeah. And I absolutely want to dive into that with you, because I think if we could just have a few takeaways for women to do to become empowered, and to start being able to make positive changes as they transition. It's just vital information. And, and we have to say, like, the research predominantly has always been on men, right? And it doesn't translate to our bodies at all.
Right.
And all of the stuff that really almost all of what we're hearing for feeding, for fasting, for training,
for medications, for hypertension and heart disease management, all of those studies are done on men.
Yeah, not on women.
Yeah,
but that is
rarely
starting to
do
change.
you see women in those cohorts.
That is starting to change.
It is starting to change.
So let's talk a little bit about and then we'll dive back into this transition a little bit. Let's talk a little bit about GLP-1s. Okay. So commonly known as semaglutides, Wegovy, tirzepatide. They're being nibbled on like candy these days, right? And I think they're a powerful and positive drug. Mm-hmm. I think they're important. I'd love for you to teach us a little bit about that. But then I also want to talk about the ways they're being misused, misprescribed, and the risks and downside of kind of relying on these drugs to keep our weight down during our transition. Well, not just these drugs are for all folks, diabetic, pre-diabetic, they apply to lots of people. In this particular topic, though, we're going into perimenopause and menopause. Let's kind of address that area a little bit. Yeah.
So GLP-1s are medication that stimulates a receptor in our body that is part of the satiation. they're called incretins. And so these come from our body when we're full, and they send messages to different parts of our body. One part of what they do is it slows down gut transit. So when you eat food, it slows down the transit through the gut. And so it stays in your stomach for longer. You feel full for longer, and you're not looking for that next meal. Secondarily, it decreases insulin resistance. So it increases pancreas production of insulin, and it helps the muscles listen to the message of insulin. So that's actually a really important piece for metabolism. And then the other thing that it does, which is really cool and very important, is that it actually feeds back to the brain, to the appetite center in our brain, and it tells us we're satiated, we're full, we don't need to eat right now. And so that is where this sort of food noise comes from. And we've talked a little bit about how, we are still caveman. We evolved over the many years as cavemen. We were hunter and gatherers. We had to look for our food. We had to think about where's our next meal coming from. And so that is evolutionarily in our body to seek food and to be thinking about it and making sure that we are going to stay fed. And so if we can turn that down, since we're no longer living in caveman days, and we happen to have a whole refrigerator full of food, we don't have to spend all day thinking about it. And I think a lot of people get into trouble because they are thinking about food so much that it becomes part of their daily routine. And so trying to get our minds off of food, I think, is really important.
Yeah, the food chatter is really interesting, isn't it? I mean, it is. I don't know if it's evolutionary or if it's how we're brought up,
or a combination of both.
Or really a combination of social media and stress and anxiety and how we're not managing it, because life is complicated these days, right?
Yeah,
and we all have so many stressors. And I think food noise is my patients who have been on the drug. That's the biggest thing that I've heard positively is that chatter is finally gone for them.
Yeah.
And they can just I'm actually not hungry. I actually don't have to have 5 donuts and a croissant. I can just have this.
Yeah.
And I feel sustained and I feel, full. But I think there's some other health benefits too of GLP-1s that are emerging as well, right? Cardiovascular.
Yep. Yeah, I mean, these medications were developed to help folks with diabetes, and they work great. I have lots of patients that take these for diabetes. But by the way, we realized in these folks who have diabetes, they were losing weight, and their insulin levels were, normalizing, and their blood sugar levels were so much better. And turns out it works for weight loss. And so now there's everyone knows because it's so much in the media, we're using them for weight loss in folks that meet certain criteria. We're using them in folks. It significantly decreases obstructive sleep apnea, which is known to be associated with increased risk for heart disease and stroke and all sorts of bad things, hypertension. We also know that folks that are on GLP-1s are at a significantly decreased risk for heart disease and atherosclerotic cardiovascular disease. So that's heart attack and stroke. So there are some newer studies that are suggesting that may be an indication for folks that do have a lot of risk factors for heart disease.
Like in their family. Yeah.
Yeah.
Because that's the number one killer of women, right? Heart disease?
Sure is. Yeah. More so than breast cancer or pretty much anything else.
Yeah. So then it sounds so positive, right? And I think that's maybe why so many people are wanting to use it.
Why aren't we all doing this?
Why aren't we all doing this, right? So then let's flip it and look a little bit about some of the negative things that are happening. And a lot of it's in the media, the Ozempic face. People are talking about the Ozempic face. And,
yeah, that's real.
And it's a real thing, right? But I think what we have to realize is that this drug is catabolic, meaning that if you're not feeding your body and you're on one of these drugs, your body's still going to feed itself from your muscles.
It's got to come from somewhere.
From your bones, from your tissues. It's not going to feed itself just from your fat stores. And this is a really important thing to keep in mind when you're embarking on this journey of taking a weight loss drug like this.
Yeah. Yeah. I have a lot of patients that I do treat with GLP-1s for weight loss, but I absolutely require we call it a multidisciplinary weight loss program. And not just here's your prescription, see you later, alligator, but let's do check-ins. You need to commit to 150 minutes of exercise per week, which is only 2.5 hours. It's not that much. You need to see a nutritionist, a dietitian, so that you can understand how to change your diet and how to adjust it so that you are healthier. And you need to, I actually recommend and require that somebody see either a coach or a therapist to talk about their relationship with food, because in our culture, we don't just eat when we're hungry. We eat when we're bored. We eat when we're stressed. We eat when we're, procrastinating. So many other reasons that we eat. And I think it's unethical for doctors or providers to prescribe these medications. They are very powerful medicines and not have follow-up. So some folks are getting them online. It's dangerous. It's like the Wild West out there.
The dark peptide market.
Yeah, the dark peptide. It's the dark web. And they're losing all this weight because they're not hungry. But what they're actually losing is their muscle mass, their lean muscle mass. They're losing bone density, and they're losing some fat. But that's where the Ozempic face comes from, because they lose all the skeletal muscle in their face and it's all sunk in.
So, setting the stage then for the perimenopause and menopausal woman who's already losing lean muscle mass,
right?
Which we know from research is absolutely pivotal to longevity and health.
Absolutely.
If you want to be upright and active, over when you're past 50, 60, 70.
And run out to your grandkids and not fall over when you trip and not break a hip.
You got to keep your muscle mass. You have to. So it's this really double-edged sword. And that's what I think I'm most afraid of for women, is that it's an easy way to lose weight, but you have to do the right things alongside of it.
Do it right.
Right. And so the right things alongside of it is what we're going to get into a little bit.
That's why we're here.
That's where we're going with this, because it's actually not that much.
Yeah.
Right. And you can really have a beneficial experience, I think, with these drugs. Before we dive into that, though, let's talk a little bit about cortisol, which we really haven't talked about that much yet. We mentioned it a little bit with it being so disruptive with sleep, and chronic inflammation. So cortisol is, keeps us alive, right? It's not a negative hormone. It's vital.
Stress hormone.
It's the king and queen of them all, right? It gets us up in the morning. It puts us to bed at night. However, when it's got a low grade chronic elevation in our bodies, that's where it plays havoc with us, right? Our sleep, our hormones, our inflammation, our
increases
pain,
fat storage,
all of those things. So, let's talk a little bit about how, I think maybe what has bugged me the most sort of in fitness trends over the years has been the zone 2 training, which is like the low steady burn, right? It's the, not to say anything bad about certain training methods, but certain training methods put you on, kind of a heavy, high rate kind of cardio type of system.
90-minute spin class.
Yep. Your spin class, your Orange Theory, your F45, all of these zones where women are going crazy for it. They're sweating up a storm. They're working out for 45 minutes to an hour. They're burning calories. They're going in there, and they're usually going in there unfed. Which we'll also talk about with cortisol. They're going in there unfed.
Fasting,
Yep. Because they think they'll lose more weight that way. They're cranking on it. And they are getting fatter and more exhausted.
And losing more muscle mass.
Yep. And they're still got that tire around their middle.
Yep.
And they're going crazy. They don't know what's happening. So talking about, I think one of the most important aha moments, certainly I think for both of us in our experience in menopause, has been learning to feed yourself before you train. Right. Because we wake up with elevated cortisol and our body, women and men are really different. Like we wake up, if we don't eat anything, the body says we are under stress and we're not fed and we're not fueled. This is an emergency.
That's the caveman. And it says, where's my next meal coming from?
Where is it?
I am stressed. I have to find something.
And it doesn't take it from your fat stores. This is where everyone thinks it's going to burn fat. It doesn't take it from your fat stores.
We wish.
It takes it from our lean protein, our lean muscle mass.
It's easier to oxidize.
Exactly. So we start off as women, we get up, we have a coffee, right? We go work out for an hour. We are just like, we are going to get nowhere because we're in this highly elevated cortisol pathway. And then especially with something like the most common and most popular fitness trends. So we're just left with this, we're left tired, exhausted, depleted, and we're not making gains.
And we're just stacking cortisol on top of cortisol.
Yeah.
You wake up, your cortisol is high, then you eat, you drink some coffee, so you've got some caffeine, you bump that up a little more.
Yeah.
You train without being fed, and there's your cortisol going higher and higher and higher.
Right.
And it doesn't go away right away. That sticks with you for a while.
It sticks with you. And the sleep disruption is huge.
Massive.
And so really the solution for that is really easy. And I encourage everyone listening to this show to immediately implement a little bit of carbohydrate and protein before you train.
Yes.
I'm not hungry in the morning before I train.
I'm never
You're not
hungry
hungry.
either.
So there's really simple solutions. One of them is a protein coffee, which is my very favorite because I love my coffee. And it can be as easy as you can take a Fairlife, like a chocolate milk Fairlife with 30 grams of protein and put a shot of espresso in it and some ice and
there you go.
Off you go and you're ready to go. Or you can make a concoction like that at home. Like it's not hard to make protein powder and coffee and mix it together.
Right.
And then you've got everything you need, or you can have a little bit of yogurt, or you can have a half a banana, a bit of yogurt. The important thing is a little bit of
nut butter.
carbohydrate,
Yeah.
a little bit of protein.
Yeah,
Just
exactly.
a little bit, just to tell your body you're not starving.
Right.
This is not an emergency.
We're safe.
You're
it's okay. We're going to be fine.
We don't have to, fend off a tiger or
Yeah. We have to
anything
reassure
like
the
that.
caveman.
Right. Exactly. So that's the first thing. So setting
First
up, and then also it's going to set yourself up for sleeping,
Yes.
right? Because if you start off with elevated, messed up cortisol, you're going to end with elevated, messed up cortisol.
Yeah, that's going to end up with insomnia, difficulty falling asleep, and then difficulty staying asleep.
Right.
So some
And-
people fall asleep fine, but they may wake up in the middle of the night and then they can't get back to sleep.
Well, and that's such a blood sugar thing too, right? Because
is.
your blood sugar is dumping.
Yep.
And then your cortisol can't come up high enough, and you're in a crash in the middle of the night, 3 a.m, and your adrenaline shoots up, right? And then you're wide awake. It's 3 a.m. You're like, you're hot. You're wide awake. You can't recover, right?
Yeah.
And that's all because of how you started your day off. So cortisol is so important, and we can manage it, but we have to do just a few things differently.
Right.
So talking about training, I think we're bouncing around a little bit, but I want to talk a little bit about high intensity interval training, right? Which does elevate your cortisol, but
But it's a game changer.
it's a game changer.
The way
right?
you do it.
Right. It's really different if we elevate cortisol. When you do high intensity, and we're talking like 45 to 60 seconds of something as hard as you can possibly do, like you're dying on whatever it may be. A rower is great. An assault bike is great. Running stairs is great. So you're pumping yourself as hard as you can, but then you're taking a full 2 minutes to rest.
Yep.
You're bringing your heart rate all the way back down again. And that gives this huge spike in cortisol, but then it gives you the recovery.
Yeah, the acute spike is different than the chronic cortisol levels.
Exactly.
Yeah.
And that's the difference in the training methods between that zone 2 training as to something like a HIIT training.
Yep.
And then what happens with the hormone cascade is what actually creates true weight loss. Circling back to the weight loss piece and why we
Yep.
aren't losing weight with our zone 2 training, right?
Yeah.
So it increases growth hormone. It increases,
Fat mobilization.
exactly.
Yeah. So as long as your cortisol is high, you're going to be storing fat because the caveman says we need stores for later on. We
Right.
might be starving soon.
We're going to be
But-
starving. Hold on to all our fat.
Exactly.
Yeah.
You get the cortisol levels down and you're going to start burning fat instead of lean muscle.
Yeah.
So that's where we need to be with our training. And it doesn't take as long as doing a 60 or 90-minute spin class.
Yeah.
We can be much more efficient and get where we need to be without spending quite so much time doing it. So that could be a huge game changer for perimenopause and menopausal women.
Yeah.
So eating more regularly, don't skip breakfast, HIIT, and then
The big one.
the big one.
The big one is
Go for it,
your
Annie,
resistance
because this is
training.
your area.
This is my world. I love it so much.
She loves it.
I do love it because it's so empowering, I think, to be strong as a woman. To be strong, just being strong is amazing,
Yeah.
right? We're protecting our So true resistance training. And we'll break down what that really is.
Strength training, yep.
Yeah. Because there's all sorts of ways to train. And there's nothing wrong with Pilates. There's nothing wrong with yoga. There's nothing wrong with going for a walk. All of that stuff is great, but it's different than the results we're going to get from resistance training.
Yeah.
That's where we're actually going to make a metabolic change in our bodies. You're going to build lean muscle.
Yeah.
And you're going to protect your bones.
Yeah, that's really critical. And
critical.
Muscle is much more metabolically active than the other tissues in our body. So the more muscle you have, the more efficiently you burn fuel. And so that actually helps you lose weight.
And the more fuel you need. I mean, I have a relatively good muscle mass for my age.
Yeah.
And I'm burning around 26 to 2,700 calories just sitting on the couch a day.
Yeah.
Because I have enough muscle that it is burning. Right. And so you are going to lose more weight when you burn more lean muscle, build more lean muscle. But resistance training is not lifting 2 to 3 pound pink dumbbells in Pilates class. It is not.
No, get rid of
That's
those
not what
guys.
it is. Mm-hmm. You can keep them. You can use them. You can enjoy it. It's great for joints, for specific rehab and muscle strength. There's nothing wrong with it, but you have to blend in resistance training. And really 3 days a week is your optimal amount of resistance training. And what that means, we really are looking at compound lifting moves, right? Mm-hmm. So things that use the whole body, like we're talking squats, we're talking deadlifts, we're snatches and cleans, some of your classic weightlifting moves, and you should be lifting to failure. So that means really at your 8th set or rep, I should say, you can hardly lift that weight.
Yeah.
Right? And that's where you're going to make real change and adaptation in your training and your muscles, and you're going to build that lean muscle. Yeah. Remember, you're going in fueled to this.
Yes.
As well. So you're fueled.
Key. It's a paradigm shift in what we've been taught for all the years.
It's so different than what we've been taught. And we're lifting as heavy as we can.
Yeah. And so if you're doing 10 or 12 reps, that's too many. You need to up the weight.
Exactly.
Yeah.
You need to up the weight.
And if you can get 2 more, 8, it's perfect.
That's perfect.
Yeah.
And you don't have to do it for long.
Nope.
You're talking like a half an hour and you've got plenty 3 times a week. And you will see better composition change than doing 6 or 7 days a week of your zone 2 training where you're absolutely dying.
Yeah.
You'll
and if you
feel
can
better.
add in a few rounds of that HIIT at the end of your weight training, then you can do it all in 3 days per week.
I know.
45 minutes out the door.
It's been so fun. So what we did, Dr. Marcy and I, is we started what we call Ladies Pump. Yeah. We just brought a group of us gals together, all different levels of training, all different bodies.
Yeah.
And we just did our own little, it's only been once a week for some of the ladies. Yeah. And their bodies are changing at once a week.
Oh, absolutely.
Of
we see changes in everybody.
Yeah. It's really phenomenal. But lifting, is really something where you need to know how to lift, right? You can hurt yourself, of course, like anything. You can hurt yourself doing anything. So again, with this, I highly encourage someone to help you get started with your strength program. Yeah. To guide you along the way, so that you don't hurt yourself. Because a lot of women are coming in pretty inflamed. They don't have the protective effects of estrogen anymore. Right. They have sometimes a lot of joint pain. And so some different things going on. So we have to approach everything obviously carefully. So working with someone who's certified and can help you is pivotal. Yeah. Let's talk about walking. Okay. Okay. So in my practice, again, I see probably 70% women, and a lot of them are my age, right? Or in their 50s anyways.
Same here, yeah.
And I'm like, well, what do you do for exercise? And they're like, well, I walk my dog. Yeah. 2 or 3 times a week.
I always say, does your dog walk or does your dog sniff and pee?
Exactly. And either way, it's not enough.
Either way, it's not enough. But especially if they sniff and pee, because you're not getting anywhere.
Yeah, not happening. And so I really just I try to tell them, listen, it's not enough. Yeah. It's so great for your mental health. It's great for your joint health.
Yeah. Get out and socialize with your dog and your friend and go for a walk, get into nature.
Super important.
But that's not your strength training and it's not your exercise.
And you're not going to lose weight and you're not going to build bones and you're not going to build muscle. Yeah.
Prevent osteoporosis and all the things.
Yeah, your body does not have to adapt to walking. Yeah. Right, so we're not going to make those gains. So it's really important to stay walking, but it's really important to add these other pieces in.
Right.
And I think it's just, I keep in mind, as you said in the beginning, this is less time. To do a good
it's much
strength
more
program
efficient
and some
to do
HIIT,
this
it's going
way.
to take less time.
Yeah.
Way less
100%.
time. So it's a win-win.
And you don't have to be like, you don't necessarily have to go to a gym. Like you can set this up in your own house. You don't even necessarily have to have any weights. Like you can do body resistance. You can do push-ups and you can do squats and you can do a bunch of things without having any equipment. Or you can get like a few dumbbells, get a kettlebell or two, have it at home. You don't have to go and like fight your way into like the deadlifting zone at the gym where all these burly dudes are like looking at you funny. Like I think that there's a lot of options for women to find their place where, again, it doesn't take a lot. And so if you can just do this, maybe in your garage, maybe, I don't know, in your backyard or wherever in your apartment. You don't necessarily have to pay for an expensive gym membership. You don't have to fight your way through, the weightlifting area in the gym. And it's very accessible to everybody. And it doesn't take as much time as we think.
Yeah, it's really empowering and it's so protective for our bodies.
Yeah.
And I think the other message I'd like to make sure everyone understands is even if you're in some pain, you've got some discomfort in your body, maybe you've got a little headache, maybe your neck hurts, maybe you're stiff somewhere. If you lift right, you will feel so much better afterwards.
Yeah. There's an endorphin hit that you get after exercise that just makes you feel like, gosh, I'm so glad I did that. I mean, how many times have you thought, I really don't want to go exercise? But every single time you're done, you're like, I'm so glad I did that. So just push over that obstacle.
And recognize that it's, I think we tend to turn to passive modalities. So people, love to go to their chiropractor. Thank you.
Yeah, good job.
And they love to get their massage and all the passive care stuff. But really, sometimes just getting out and moving is going to do as much.
Yeah.
And strength training, being strong is the most protective thing you can do for your low back.
Absolutely.
Certainly, which is a huge thing.
Yeah, and core is so important for your posture and your back protection.
Everything.
Yeah, for everything.
So everybody strength trains. So important. And we'll give you some notes in the show to some resources and such to have a look at.
Yeah, for sure.
So let's talk a little bit about after you've worked out. Like, do we eat? Do we not eat?
Yeah.
This is also important, right? So we talked about fueling a little bit before we trained. It's also really vital that you fuel after your training.
Yeah. You just burned a whole bunch of calories. And Caveman is saying, where is my next meal coming from?
Yeah.
And that food noise is starting. Jump on it before that starts happening.
Yeah.
So
eat a little bit. Eat a little bit of protein.
After.
That's the most important.
Yeah.
And when we talk about protein, we're talking about 1.2 grams of protein per kilogram of body weight.
1.6.
1.6.
Yeah.
1.2 is on the low end. 1.6 to 2.2 or something, depending on how active you are.
Times your kilograms.
Kilograms.
So you're going to have to figure out your
figure
kilograms.
out the math on that. For me, I should be having 110, 120 grams of protein a day.
Yeah. For me, 1.6 is 108. So yeah, probably 110, 120.
Yeah. And it's slightly dependent on how active you are, right?
Definitely. So if you're exercising, you may need more.
You really need more. And it's actually, to be honest, it's hard to get.
Yeah.
It's really easy to underfuel. And that's
so easy.
I've been terrible with that my whole life. And I really have to have a few cheater proteins. So by cheater proteins, I mean your protein powders and your protein bars. I don't recommend you live on those. You need to eat real food, but you need to have a little bit of a cheater protein for that quick 30 grams.
Yeah. Good for the morning too.
I have to have it. Yeah. I have to have it to get anywhere near my protein macros every day.
Yeah, and I think it's really important for women, and I recommend this to my patients, to actually track their food over like 2 to 4 weeks and really pay attention to what is going in. And it is remarkable. I mean, they'll come back and they'll say, oh yeah, I got like 40 grams of protein. I'm like, that's not enough. A salad does not have protein. I mean, there's not much there. So you're going to have to put something in there. Put some cheese, put some tuna, put some chicken, whatever.
When I started out with this whole being aware of how much protein I was eating about 60 grams a day.
Yeah.
And I was exhausted all the time.
Right.
I was so tired.
You didn't have enough fuel.
I did not have enough fuel.
It's so common, and I've fallen into the same category for years.
Yeah.
And now I know why.
Yeah.
Yeah.
Well, great. I think we've covered most of our main points.
I think so.
We want to discuss.
Yeah.
Yeah. Great. Well, thank you for being on the show. And we will drop your information in the show notes so people can know how to get a hold of you.
Yeah.
Dr. Marcy is doing menopause coaching.
Menopause
So
coaching. It's called Comfort and Confidence in Menopause. And it's drmarcynelson.com. And that's my website. So look me up.
Yeah. And at Head to Toe, we also have training specifically for women. So we've got that available for women, which is nice. It's private. It's a great, safe place to start.
With a wonderful coach.
Yeah, really great coach. And plus we're big proponents of the InBody, which is just a machine that gets women away from looking at the number on the scale and more looking at body composition. So you can learn like, hey, where's your lean muscle mass at? Where's your bone mass at? Where's your fat mass at? So when you're starting down this journey, especially if you're considering going on a GLP-1, it's really vital that you have that information so that you know that you're maintaining that lean muscle mass, which, as we discussed, is absolutely vital for your health and longevity. Yeah. Well, thank you so much for being on the show.
Well, thanks for having me.
Great conversation. We'll have more.
A real pleasure.
Yeah.
Thanks.